And lastly, could you talk to us about vitamin D? What do we need to know about it?
Important thing to know about vitamin D is obviously, whilst it's classed as a vitamin and as a nutrient, our main source of vitamin D is through the action of ultraviolet light on the skin. And in the UK, we can only make vitamin D through the action of sun on our skin between the months of about April to September, because that's when the sun is at the right angle within the sky to be able to make vitamin D within our skin. So where you live within the UK will influence that. If you live the further north you go, that will also influence your exposure to vitamin D. Obviously, your skin color will also influence. Darker skin tones need longer in the sun to get the same level of vitamin D, because obviously the pigmentation in our skin acts like a natural sunscreen, and we need longer within the sun. So people with darker skin tones who live very far north within the UK, they will struggle to make vitamin D to reach the optimal levels. Throughout the winter, so between October and March, we don't make any at all in the UK. So it is now recommended that we're supposed to take a supplement throughout the winter. And especially those people who are more at risk, people who cover their skin, people with darker skin tones, people who are indoors all day, people in care homes who spend a lot of their time indoors. All of those people are more at risk of vitamin D deficiency.
Now, dose recommendations seem to vary wildly. Can you help us unpick this a bit?
I think a lot of the research has been done, and a lot of what we are taught about vitamin D is about it's important for bone health. But what we also know is that vitamin D receptors are again all over our body, and that it's what we also now are now increasingly finding, and more research is being done on, is that vitamin D is really important for how the immune system functions. And vitamin D deficiency is associated with lots and lots of different conditions that are affected by the immune system. So, for example, multiple sclerosis, you're at much higher risk of developing multiple sclerosis if you've had a vitamin D deficiency. And then again, when you look at throughout the UK, the incidence and prevalence of multiple sclerosis increases the further north you go. So Scotland and Northern Ireland have much higher prevalence of multiple sclerosis than England, for example. So it's important that we consider vitamin D beyond just bone health. And this is where I think it becomes quite difficult to unpick within the research. And something that I've only learned within the last decade is that magnesium is needed for the enzymes that metabolize vitamin D within the body. So, for example, when our body activates vitamin D into the substance, the type of vitamin D that is needed to create the activated form, those enzymes that do that job are magnesium dependent. So if an individual is magnesium deficient, they may take a vitamin D supplement, but their body won't be able to access the active form of vitamin D. So again, confounding within research for vitamin D supplement studies, we're not looking at magnesium deficiency within vitamin D studies. And when you look at the SACN report for vitamin D, calcium is mentioned throughout that report over 300 times. Magnesium is not mentioned once. So it is really important to consider that magnesium is needed, and we need to be replete in magnesium in order for us to be able to actually access the vitamin D from a vitamin D supplement. And that's potentially why we've got these wide variations in response in various different intervention studies for vitamin D. And I think this needs to be looked at in a lot more detail going forward within vitamin D research and looking at various different doses.
And could you give us some guidance as to what kind of supplements people might consider taking?
With vitamin D, obviously it's a fat soluble vitamin, and therefore it's important, as with all nutrients actually, we really should take them alongside a meal, because the body is then gone into digestion mode, and we're much more likely to take the nutrient out of the supplement if we're taking it at a time where our body is in a digestion mode. So we take vitamin D supplements alongside a meal, certainly a meal that's containing fat, that will help with absorption. In terms of doses, it's a difficult one because the recommended dose is 10 micrograms, which is what we're recommended nationally within our recommended guidelines. But I think increasingly there are, and you'll see it through what the supplement companies are creating, because there is actually a need, and lots of people are finding through their own personal experimentation that quite a few supplement companies now create supplements that contain, instead of the 400 units they contain, or 800 units, they contain 5,000 units. So and again, if you go back to the micrograms dosing, some supplements are 100 or 200 micrograms rather than 10, which is what's recommended. And I think for some people, they find through their own trial and error that they are responding better, and that when they have their blood levels checked again, a low dose doesn't actually make them replete or optimize their vitamin D levels. And we do find as well, when people become deficient, they do need quite a large supplemental dose, and a lot of the prescribed doses are the orders of more than 10,000 units in order to get somebody back. So it depends where you start from, and I think what's important is to know what your own level is, to consider magnesium alongside. Might you be magnesium deficient as well, and then consider what dose may be needed for you as an individual to get you up to a good optimal blood level.